Good evening everyone. I am Anette Marina Rodrigues. I am from India but I am working in Abudhabi, UAE. The title of my topic is a study of knowledge, attitude and behavior, KAB survey on overweight and obesity, health consequence and adapt to lifestyle changes to maintain balanced weight diet and exercise by early middle age group 23 to 35 years medical and non-medical healthcare staffs of NMC Daycare Center, Abu Dhabi, UAE. The summary of my survey is KAB survey helped me to identify changes in knowledge, attitude and behavior of individual in short duration of time, that is within 2 months of time. The effectiveness of health teaching with diet, exercise and health consequence help the individual to have change in their lifestyle and modify their body image. The results have brought positive changes on individuals of early middle age who would plan to adapt and few already started to adapt to changes. By this turnover, my management can plan out time for physical activity for our staff in the facility like yoga, Zumba and indoor gym. So what? The problem on overweight and obesity has become a major risk for health illness like cardiovascular, hypertension and diabetes. As a healthcare provider, my duty is to educate the staff on these issues to avoid early occurrence of symptoms and procurement of disease. According to my studies, according to my background, this is a non-experimental descriptive study random cross-section conducted on 30 staffs out of 120 medical and non-medical staff of my facility, working since 2014. 2 months convenience sampling done using semi-structured questionnaire. In that the BMI in 2014 shows 73.3% normal, 23.3% overweight and the remaining obese. And the BMI in 2016 showed 36.6% normal, 46.6% overweight and 10% obese. So hence when you look at this scores, the overweight and the obese, there was drastic changes as you see in this graph from 2014 to 2015. The normal range is at a higher level in 2014 to 15 and the overweight was less than half and the obesity was quite less. But whereas in 2016 the normal range of the weight was alarmingly low and the overweight was more compared to the normal range and the obesity also has been increased. So this is a striking score and alarming sign which needed to be considered, and I decided to do a research and find out the knowledge, attitude and behavior of my staff on diet, exercise, body image and health consequences. So in our facility, we usually do the health screening 2 or 3 times in a week for all the patients, outpatients and as well as children. Then I also thought that why can't I do an assessment for my staff. So hence I also planned out to do this assessment. So according to the KAB survey, the gender male, the male staffs N16, female were 14, the age group was 23 to 35 years, weight was 40 to 105 kgs in between that, the height 160 centimeter to 174 centimeter, and the BMI had a varying. Community of origin Indian 16, Nepalese 4, Middle East 2 and Philippines 6. The education was medical 14 staff, non-medical 16 staff, and job criteria was registered nurse 11, practical nurse 3, front office executive 8 and messengers 8. And the limit of the staff, the working is from 16 months to 2 years. So majority of the staff were from 16 months to 2 years, and there was a split shift of the duty usually from 9 to 21 hours, that is 4 hours break in between for 26 staffs, and straight shift from 9 to 6:30 p.m. that is continuous shift only for 4 staffs. So the split shift has a majority of the staffs working for that, so did not get time for any other physical activities. So methods used was observation. So since I was observing from 2014 for all my staffs, I came to know that obesity has been increasing, and I also conducted a pre and post test questionnaire, 15 questions for a gap of 2 months, that is pre-test in August end, and in by October I gave the post test. So then I also conducted health education on PPT on health-related complications like diabetes mellitus, hypertension, cardiovascular disease, and their prevention. Printouts were also given on 24 hours menu for vegan and non-vegan diet, and the calorie requirement of 1200 to 1600 was included in that. And I also give out printouts for different exercises like gym, yoga, Zumba, swimming, cycling, jogging, outdoor activities. What are the benefits, what are the uses, and how to use it, and which is the best option for them. So they needed to select all these from this health education and the printouts and the PPT which I gave. So according this, I also give them a body image, the ideal score. That is, this is a tool parameter in order to find out the body image, their present body image, and their present and the ideal. Present body image, it will be the scores were a bit higher. That is, it came to 8, 6 to 8, and exist like they wanted to plan out for their future at a range of 3 to 6. So according to the results of the pre-test and the post-test which are conducted on the diet, the 0.73% were having a positive attitude, staffs were having positive attitude, and the remaining 0.27% had a negative attitude towards this diet, and they didn't want to follow it. And with the post-test, there was a higher rate of 87% positive result and 0.13% still did not feel that they need to change their diet. Similarly, in exercise, the pre-test post-test result also showed that 0.33% had a positive attitude toward exercise, and the remaining large group had a negative attitude. And later, after the PPTs and the education, this increased. So this vast difference of pre-test and the post-test, the attitude towards the exercise and was implemented. Similarly, the body image also present shows the red line, which indicates that the highest is 6 to within a range of 4, 5, this range, and the ideal is they want to do come to a level of 2. So this is a very good indication for to change of body image among the medical and non-medical staffs. The health information result in September, that is before I give the pre-test. When I gave the pre-test, they had about 80% of the staffs were positive towards the health, that is related to diet, the hypertension, cardiovascular disease, etc. And a few were around 25% were unaware of it. And later, after I gave the health education, within a gap of 2 months, they had a 100% result. So this is a extremely good thing which I came to know about. So references of obesity prevention and management, the global epidemic report of WHO consultation. Second one is a study to assess knowledge and attitude of adolescents on obesity as selected senior secondary school. And the third is obesity related knowledge, attitude and behavior in obese and non-obese urban Philadelphia female and adolescents. Conclusion: with my research, the medical and the non-medical staff, about 30 of them, of my NMC Medical Center are aware of their own self, diet, exercise, and prevention of disease in earlier ages. So this is a type of primary prevention, so that they will have an idea of what things to be done in their life. So this has also helped the staff to have lifestyle modification and balanced work and time for self. Few of them have already started to go to gym and doing indoor home exercises around 1 or 2 hours in every 3 days. So it is a positive sign that they want to change themselves and change their body image. Future steps for my research: build awareness for all 120 staffs in my NMC Medical Center about lifestyle modification and reduce of overweight and obesity. And we have 9 hospitals comprising of 30,000 staff. So I am also planning to publish this in the NMC Pulse. We have a magazine. So hence it will reach out to 20,000 to 30,000 people who are working for my of the different hospital groups. And management also have plans to start weekend gym and Zumba for all the staff based on the interest, their research, which will have a positive impact on all. So this research will show that not only the patients need to be guided with the health education, the staff also need to be trained on their lifestyle modifications, because as they grow older, their chances of getting different diseases like cardiovascular, diabetes mellitus, and other stress-related diseases. So by this research, surely I feel that it will have a positive impact on all the other 120 staff, and with my publications, it will be very effective. Thank you.